according to the governor, Willie Obiano, the results of the 36 samples collected from contacts of the index case that were kept in protective centers and submitted for testing are being awaited. Anambra State in the southeast of Nigeria is one of the states with a very low COVID-19 case index.
All right, since the recovery of the disease in Nigeria, the State Isolation Center is yet to be filled with COVID-19 patients compared to that of Lagos, Kano, and Abuja.
Well, today we'll be looking at the measures being put in place by the state so far to curb the spread of the virus, that's the coronavirus, and other matters arising from the pandemic. And joining us now from Awka is the State Commissioner for Health, Dr. Vincent Okpala. Thank you so much, Dr. Okpala, for joining us today on the morning show.
Thank you very much. Good morning.
Great. So Anambra is one of the 2 states in Nigeria with the least confirmed cases, the second being Abia State. You have only confirmed 2 cases so far, and 1 has been discharged. So currently you only have 1 active case. Do tell us, Dr. Okpala, what do you attribute to this number? Is it a lack of testing? Or would you say you've had an efficient approach, comprehensive approach to responding to COVID-19? And also, can you avail us of how many tests have been conducted since the index case on April 10th?
Okay, thank you very much for the question, and thank you for having me. Well, first of all, when you asked what we attribute the low positivity in the state to, I would say 1, providence, 2, preparedness. It's on record that Anambra State actually opened our emergency operations center to address Lassa fever and COVID-19 as early as January 15th, 2020. Now, our EOC started operation then, and we started our active surveillance. We started training personnel. We started sensitizing the public. Before the index case arrived in Nigeria in Lagos, the case that arrived from Italy, we already had an active surveillance system in Anambra State for COVID-19. We were already going to markets, sensitizing our people, going to communities. It's on record that we actually started putting people on quarantine before the index case arrived in Lagos. And as before the index case, we had about 5 cases, different cases that we followed up with, people that coming back from China, who we placed on home quarantine for 14 days before clearing them. So there was a high degree of awareness already in the state before the nation started actually fighting COVID-19 actively. That is 1. So the structure that disaster has put in place is very robust with respect to infection prevention and control. There are a lot of community mitigation measures that have been put in place to help with containment of the spread of this disease. So we really, and we have an itinerant population. So with that degree of awareness, I think we've really had a little bit of success. It's not like beating our chest, but I think this structure that I've put in place has actually helped. People have learned to notify the system if they have anybody coming into the state in their neighborhood from anywhere we have a high transmission of the disease. And this also includes people coming from abroad. So once we get such calls, we follow up immediately. Now, with respect to the number of cases, the tests we have done so far, I mean, we've done 108 tests as of yesterday, but be it also known that anybody that needs to get tested in the state that meets case definition gets tested at this point. Thank you.
Commissioner, I want to ask this. I want to talk about measures you are putting in place in crowded places. We all know places like Onitsha markets. And I was shocked to see the videos that came out that the governor, Willie Obiano, had to intervene. I'm talking about the Niger Bridge, the influx of people. I'll be very sarcastic to say it. In fact, that was the height of social distancing. You know, when people huddled around on the bridge trying to make their way to Asaba and coming back. So it's been a bedlam in Onitsha. And that's why some people will say, goodness me, 108 tests for what has been happening around that area. What measures are you putting in place?
So basically, yes, what we saw at the Niger Bridge is just a snapshot of some of the things we see around the country at this point. But the point is, there is a structure we have in the marketplaces. We have trained COVID-19 task force in each of these markets. We have a team of about 10 to 15 individuals that are from these markets that are trained to help make sure that the community mitigation measures that have been put in place are being enforced, like hand washing stations, people actually washing their hands, especially, and having hand sanitizers in shops, wearing of face masks and what have you, and identifying people coming from outside the state and notifying the system to follow up with those people, screening with infrared thermometers and all those. Now, with respect to what you saw in the bridge, it's actually, Anambra State is a state with a high number of traders. Now, when you notice that the movement at Asaba Bridge, even though not very welcome, a number of our population in Onitsha actually live across the bridge. They live in Asaba. So they come to the market in Onitsha to do their daily activities and return back via the bridge. What you saw there was because we blocked vehicular movement on that bridge, and people actually now tend to travel back to their abode in the evening. You know, so it's almost like two neighboring states that we brothers and sisters living together. And we actually we're putting measures in place to make sure that that is controlled to a very good extent. So the picture is not a good picture. We are improving on that. But just know that our markets have a task force that are trying to make sure that we keep COVID-19 away from our states.
Well, in another development, there have been reports that not fewer than 30 vehicles loaded with about 90 passengers were intercepted along the Enugu-Benue-Kogi boundaries. So my question to you is, with people coming in that way, and also even coupled with the Almajirai, who have even been called out by traditional rulers and monarchs in Anambra State, saying that it's not possible for them to get in during this lockdown. I'm curious to know what you're doing to put a stop to this. Are you taking them in and putting them away in isolation for 14 days to be able to do testing on these children? I'm curious to know what your plans are about this.
Okay, if I got you right, you mentioned Kogi, Benue State, right? Not Anambra?
No, at the border. I'm saying that they were intercepted at the borders, and then there are also reports that there are Almajirai children making their way into Anambra State. And monarchs and traditional rulers have called for them to be returned. But my question to you is, in a case like this, are you going to be putting them in quarantine, doing any tests on them to make sure that they don't spread community, there's no case of community transmission?
Remember, actually, that there is we have, first of all, interstate travel at this point is banned at federal level. So we respect that. We only allow essential commodities to come into the states. Do I have him?
Yes, I can hear you. But there are people that are taking advantage of that and hiding in rice bags and covering themselves up, staying on the back of trucks to sneak themselves into the state.
What you're saying is very correct, but in our states, our borders are really well patrolled. When you come to our borders, like let's say the Bridgehead or the Amanse border, you have policemen, you have political appointees, you have a lot of trained people on that border. You have medical personnel. The health personnel will screen people, especially with those passing the 18-wheelers bringing in essential goods. We make sure that it's only the driver and the passenger, so the conductor that are coming in, and they will be screened. They'll be asked some basic questions. We have an instrument we use to gather information from people coming in. But we won't allow a truck loaded with people to come to the state like that. But assuming any such thing ends up happening, the system gets notified because we have a surveillance system already set up. And such an individual, assuming it happens, will be picked up by and then put on quarantine.
It's Interesting you talk about the surveillance system in the state. Whilst Governor Willie Obiano, in his latest state address just yesterday, raised concerns about the emergence of the second case in your state, who came in from Kano State, beating the interstate travel ban in existence. So how confident really are you about that surveillance you talk about when your second case in the state has just beat that surveillance you talk so much about? But apart from that, let me ask you what the effort has been in contact tracing, especially for this second case. Are you worried that there may be many like him, suspicion? Is there a high level of suspicion of such cases in your state at the moment?
Okay, let me address the surveillance system. If we do not have a structure in place, a system in place, we will not have actually picked up patient number 2. Patient number 2 was picked, the patient came in, I know, well, you have a system in place. Once in a while, you have somebody beat that system. But because we have a surveillance system within the state, now that was how we got notified that this individual came into the state from Kano. Remember, this individual actually is a resident of Anambra State that traveled to Kano for business and now returned to Anambra, beating the borders. But on coming back home, we got notified because we have a system on ground at the community level, and we got called. That was how we were able to respond and then tested that individual, and the individual came out positive. If there was no system in place, actually, we got that call with the same day the person came back, and we picked up that person the next day. So if there was no system in place, we would not actually have picked up this individual. So that is the point.
And the second part to that, the contact tracing for this second patient you have in the state, what has been the effort so far? How many numbers are you looking at?
So far, we are looking at about 15 contacts. It's still too early to say because, I mean, first-degree contacts. Because, you know, while interviewing the first-degree contacts, you may actually start hearing about others. But so far, so good.
Right. I just want to harp on that part, this was talked about. What if in a scenario, and I'm sure that scenario is currently happening in Anambra State, you have to tell me otherwise and correct me on that. There are many people that are getting into the States. They've gone to trade probably in Kano and some other parts, even from Lagos, endemic with COVID, and their family members are not giving them up. Their family members are not talking about them. They are not alerting the state about that. What are you doing as regards that? Their family members are not giving them up. They're not alerting the state. Secondly, I want to talk about, you know, the preparedness of the isolation centers and the impact of COVID on the healthcare system in the States. What's the impact like already? I know it's just 2 cases. I know that. But I'm saying that very strongly because Lagos was just 2 cases a couple of weeks ago. Now it's over 1,000 cases now.
Okay, thank you for that question. I have to reiterate that with respect to the community efforts that we have in the state, most of the calls we've gotten, people that we classify as patient under investigation, the test that we've done, came from family members, came from friends, came from people actually asking, giving themselves up. So it will be unfair to say that family members are not actually notifying the system. Our system has been so sensitized that neighbors are actually calling to say, I'm really concerned about this. My neighbor, he just came back and from beat the system and came back from Lagos. You know, as a matter of fact, there was a situation in the state just last week. The community heard that a corpse was going to be brought back from a particular part of the country, and they called that individual and said, I know you are some, but do not come back. Do not bring this corpse back. And we got notified. You know, I mean, we are not saying that we are stopping corpses from coming into the state because the NCDC guideline allows these corpses to be buried. You know, but it's our job now to educate the people, the community. But if they are not sensitized enough, this is their son, this is their brother, this is their father and others. But they came out in mass to do that. We noticed this happening all around pockets. So people are truly sensitized enough. And I bet you there's no family here that you have somebody returning from a place of high transmission, and then they just take that person in because we have sensitized them enough about this, about COVID-19. So, and we hope that that stays. And we continue to do that. We've not stopped. Now, with respect to the isolation centers, your question was how efficient are they?
How has it affected the healthcare system in the state, and how ready are the isolation centers? For instance, how many ventilators do you have in the isolation center? How ready is the isolation center, and how has this impacted the healthcare system in the state, sir?
Okay. Basically, in Anambra State as a state, we have about 20 ventilators, but the isolation center, the good thing about, we call them protective care center here. Reason is because we noticed that when you use the word isolation, which is actually the medical and scientific word to use, the stigmatization of the disease gets worse. So in Anambra State, we chose to call them protective care centers. We have 7 of them at this point, and one of the bed capacity for now, we are okay with it, and we're praying that we don't have enough diseases.
What's the bed capacity, sir? The number of beds you have, sir?
Right. One of the centers has 240 beds. One of the centers has 58 beds. In total, we are hitting over 500 beds. And one of them, like the one that has 240 beds, has the capacity to put up to 1,000 beds. The facility where this is nested. So where you already have beds is about 240. So we have the capacity to stretch up to 1,000. Our prayer is that we don't get to the condition where we use these beds, you know. So we have trained enough personnel. We've trained over 150 personnel on IPC and case management, and trained by WHO, NCDC, and we continue to cascade this training down to the community level.
Thank you very much for that, Dr. Vincent. I would need to ask you about this, to confirm this for me. The state government did, in fact, take steps to decontaminate the home of the first index case. Now, if you indeed confirm this, I would also like to know if it's something, a practice that you would be doing going forward. Is this something that the Anambra state government is going to be doing once you've confirmed a case, you go back to their house and decontaminate it? Is this something that Anambra state will be doing?
Yeah, that is what we'll be doing. And actually, we've done the same thing for the case number 2.
Okay, my colleague asked you earlier about the implications of COVID-19 on the health system in Anambra State. I'm not sure I got a response to that, but let me add to this, because before the emergence of coronavirus, Anambra State joined the long list of states in Nigeria in recording Lassa fever. What is the attention you are giving to other diseases at this time whilst you respond to coronavirus?
So I mean, talking about implications to the healthcare system, and that's really a great question. So, like I mentioned earlier, when we opened up our emergency operations center in the state, January 15th, it was actually in response to the Lassa fever. Then January 29th, the epidemic that was going on at that point around us. January 29th, we confirmed our first case of Lassa, and now we had a joint response to both COVID-19 and Lassa fever. And that surveillance for Lassa is still in place. We like in the past few weeks, we've had a patient under investigation for Lassa, a couple of them, and they all came back negative. So our surveillance has not gone down with respect to something like other diseases. But that being said, last year around November, we made our annual operational plan for 2020 in the Ministry of Health. So this plan was supposed to see activities starting from January 1st to December 31, 2020. Now, a lot of community mitigation activities that have come in place with respect to
Dr. Okpala, do we still have you?
Hello?
Okay, I think we have lost connection with the Commissioner for Health, Anambra State, Dr. Vincent Okpala. As soon as we reconnect with him, we'll have him respond to
I can hear you.
questions.
I can hear
Okay,
you.
great to have you back. Yes, you were responding to my questions about the health system and your response to Lassa fever so far. But can I just chip in there? Do you have any challenges in responding to COVID-19 so far? The Presidential Task Force had talked about states ramping up the isolation centers, having at least 300 bed spaces. Well, you have said in your state you have about 500. That is good. But are there any other challenges you're having?
The best health systems in the world, USA, China, Italy, all had challenges dealing with this condition. So there are always challenges in the healthcare system. Talking about South Nigeria, where we have a health system that needs a lot to be improved upon. So we would like to see more personnel. We would like to see more training, and then resources. But so far, so good. That is the point I'm making. I mean, His Excellency, the Executive of Anambra State, Chief Dr. William Obiano, has put in a lot to make sure that our system gets ready to respond to the pandemic when it gets here. And when we had our index case, the way it was managed was something that we were proud about. Then the special number 2. We continue to ramp up on our community active case search, which is the next stage of the battle for us at this point. So definitely, when you talk about resources coming from the center to support what we are doing, is a challenge. We've not really seen a lot coming from there to help support our activities here.
Okay, real quickly, I've got 2 insights for you. Number 1 will be around your ventilators. You said you have 20 ventilators. Are they manned? If I need to use those 20 ventilators, will I get the ensemble that will use the ventilator and man it? Because it's one thing to have ventilators, it's another thing to have the expertise to man it. Secondly, I want to talk about private hospitals, and I talk about them specifically because, we don't pray for it like we say in Nigeria, but there might be a case where some VIPs in Anambra State, which they have a lot of VIPs in Anambra State, might be victims of COVID one way or the other, and they might want private hospitals to be able to take care of them, not go to the government, set up an isolation center. Have you started authorizing private hospitals in Anambra to take care of COVID patients? So 2 questions real quickly, sir.
So remember when I mentioned, so with the number of vents, actually, this is the total vents in the states, within Anambra State. Now, talking about having the manpower to man these vents, we have some of these vents in the teaching hospital, and we've trained over 20 people with respect to running those ICUs. Now, with respect to the choice of where to be taken care of, I have to tell you that one of our protective care centers, when you go there, is actually is put together well enough to take care of VIPs. These are rooms that are facilities that is built in such a way that you have an ante room and you have the patient room, and each patient room is self-contained with extractors, air conditioning, and all those things. So I believe VIPs, actually, any VIP that comes, if you come down with COVID-19 today, I would like to take care of in that facility. I would like to go to any other private center. I doubt how many private centers that we match what we have in there. But that being said, we have actually looked at this disease and said that is a war. We see it like a war. So you have to scale your response to the battle. So right now, like one of the days I was having a discussion with a top official in Abuja with respect to this war. I said, in the foreseeable future, do we think that there'll be a time where we would start thinking of people being managed in their home, And that discussion came up, and just a few days ago, we see that thought is now coming true. If you're symptomatic and the capacity of the system to take care of you is being stretched, then you can actually stay home. We're not doing that yet in the state because we still have excess capacity at this point with respect to our private care center. So there are some hospitals, private hospitals that...
Go ahead.
Go on.
Nobody stopped you, sir. Go ahead.
There are some private hospitals in the state that actually have capacity. When I say capacity, they have the infrastructure to take care of COVID patients. So we are already having discussions just in case our capacity gets stretched. This facility, some of them have ventilators. One of them has like 4 ventilators in that facility. So as me starts getting, we have statistics of these facilities in the state, and we are talking with them. So if we ever get to the stage where this will become a problem, we throw them into what we are doing. Once they have gone through our infection prevention and control training and the case management training, and we have trainers in the state now. We have personnel in the state who have been trained to train people. So that is the situation.
Okay, Dr. Vincent, I want to ask you, because you had mentioned earlier about how we even have people who are very open to reporting cases or sightings of people who may be showing COVID-19 symptoms. So I want to speak to how well you've been able to manage sensitization in Anambra State. Are you working with traditional rulers? Are you working with religious leaders? How well are you getting to the grassroots to ensure that you are keeping your COVID-19 numbers down? Or do you think that this is just a result of your geographical location in Nigeria for your low numbers?
I have to reiterate again the fact that the biggest thing we did before the index case came in Nigeria was desensitization and mobilization. The way we are structured, every town in Anambra State has a president general who is an elected leader of that community. And then we have the Igwes. Then the local governments have the local government chairman. Now, before the index case, we already started sensitizing the PGs, president generals of all these communities, have been called to meetings before. That was at that point. So they were sensitized. Now, we sensitized our Igwes, we sensitized the local government chairman. At the community level, we have the WDCs, World Development Committee. These are people that take care of primary health care centers in the community. In our 26 political wards, these individuals were also sensitized, and that has not stopped. It continues, and that was why before when we had a pre-lockdown restriction, we got in all the people were carried along so that at the community level, they keep on interacting and making people understand why we need to be doing the things that have changed the way we used to live.
All right. So, earlier on, Dr. Okpala, you said you're not beating your chest yet, but it would seem as if it's business as usual in Anambra State. Social gatherings are in place, markets are open. But I want to find out, what is the protocol around burials in Anambra State at this time? We do know of people who are finding it difficult to bury their loved ones at a time like this.
It will be unfair to really say that social gatherings have restarted in Anambra State. The markets are open because let's understand the principle behind opening our markets, for goodness sake.
Are the churches not open?
No, I'm coming there. I'm coming, sorry.
Okay.
We had an index case. Remember, before the index case, we had we had restrictions, okay? These restrictions were in place before we were among the first states to start these restrictions. The social, having more than 30 people gathering in a place was banned. Nightclubs opening were banned. Before we had our index case, we had churches, the churches shut down. All these things were already happening. We stopped contact salutation, any form of faith. The markets wound down before the lockdown. And the lockdown came because, we had an index case. So if you understand how this virus works, basically we had to keep people in place so we can actually conduct our contact tracing and all those.
Okay, because time is not our friend, very quickly, the burials.
Okay.
So in Anambra State right now, you can bury people but no funeral ceremony.
Okay, we'll hang it there. Thank you so much for that.
Thank you very much,
Thank you so much for that.